Gentleman from Georgia, Mr. Gingrey.
Madam Chairman, having practiced OBGYN for nearly 30 years, the reform of our health care system has been my single biggest legislative goal since coming to Congress. That's why the pill that lies before us is so painfully bitter to me. We are in unprecedented economic times. Millions of Americans are without quality health care, including those with chronic illness and low-income families that cannot afford coverage. Additionally, job losses are mounting. Last month, 450,000 more Americans lost their jobs, bringing this year's total to 2.5 million. Madam Chairman, the need for reform can be summed up no better than by President Obama's remarks to my physician colleagues in Chicago last month when he said, "The cost of our health care is a threat to our economy. It's an escalating burden on our families and businesses. Indeed, it is a ticking time bomb for the federal budget." Yet just yesterday, the CBO, Congressional Budget Office, said that this bill does not reduce the growth of health spending. And Director Elmendorf said it again today in testimony before the Senate Budget Committee. So what will this bill do? It's hard to say, as members of Congress and the public have only had a little more than, 12 hours to read this massive bill, more than 1,000 pages, which fundamentally changes our health care system. Nonetheless, let me present some of the highlights. Mr. Chairman, the bill forces every American to purchase health insurance or pay a 2.5% tax, regardless of their income, and taxes every health insurance plan to pay for this so-called comparative effectiveness research. It also imposes an 8% tax on businesses if they cannot afford to offer their employees insurance, resulting in major job losses and millions losing the health care they have today. Actually making poppycock of the Obama pledge, if you like the health care you have, you can keep it. And another pledge, no one earning less than $250,000 will see a tax increase. Mr. Chairman, this bill will not lower the cost, nor will improve the quality of health care in our country. It will, however, allow bureaucrats to take over the health care system, sell government-run insurance that American patients inevitably must buy, and tell patients what treatments they ultimately can receive. I agree with Mr. Markey. This bill does apply CPR to our current health care system. It cancels patients' rights. For the sake of every American, Mr. Chairman, Madam Chairman, we must strive in a bipartisan manner, find a real and a sustainable solution for our health care system. A one-size-fits-all government plan simply will not work, and it will bankrupt this country. This bill will not only rob the American people of their health care choices, but it will force them and our future generations to foot the bill. And I yield back my 5 seconds.